Hello, good morning, salam, namaste, IWG. If you can see this, if you can watch this video, can you say a big hello? I can see people joining us. Hi, good morning, Kajal. Good morning, Kanji. Hi, Arpita. Arpita, can you please share the link on every group? Thank you. Good morning, Kanji. Girls, I am live from Bushra Specialist Medical Centre. It's right next to Al Majaz waterfront in Sharjah. And we are going to have a very women empowerment session today. You know why? Because this is an amazing clinic run by an all-women team. And that's something which I'm very, very proud of. We are going to talk to doctors today from, things that affect all of us women, right? From the start of menarche to menopause stage. So we have questions for you. I would love to keep this session very open. So I want all of you to ask questions when we go live with the doctors. We have specialists today who specialize in Ayurveda, teenage, or kya hai hamare paas, homeopathy, everything, like literally everything that we have. So any and every problem that a woman goes through, we're going to discuss that today. And what's special about this clinic is the prices are amazing. We're going to talk about all of the special offers. Dr. Zooniya is here with me today. And we have special IWD offers which you girls cannot resist. Also, we are giving away a free teeth whitening clinic treatment to one of our amazing IWD members. So we're going to share the form below very, very soon. I want you all to fill up that form so that you can avail these IWD special offers. उसके साथ हमारे लाइफ में बने रहिए क्योंकि हमारे पास और exciting offers है. And honestly, the prices of this clinic are amazing. They have gifts if you have spent above a certain limit. So don't miss those gifts if you come here. And tell them you are from IWD, so they give you special IWD treatment. With that, let's say hello to Dr. Zooniya, who's here with me today. So I'm going to turn this around. Hello, Dr. Zooniya.
Hi, how are you?
We are very good.
Thank you so much, Reema, for coming here. It's our pleasure to have you here. What you do for our society is really commendable.
Thank you so much. It's our pleasure to be here, and we have a lot of people saying hello to you. We have hello Payal, hi Shona, hi Anju. Kanchi is really interested in offers, and we have Roshni also. So Dr. Zooniya, you have this amazing clinic out here. Let's talk through. Why don't we first do a walkthrough around the clinic, and let me just hold it in my hand. That's fine. So you're getting a lot of high doctors here there too. Let's do a quick walkthrough around the clinic, and then we'll come back and talk to all our specialist doctors in one go. So I'm going to hand over the phone actually to Dr. Zooniya ताकि आपको सबको आवाज अच्छे से आए. So there you go.
Yes. So this is our front desk reception. जैसे आप देख सकते हैं यहाँ पे हमारे reception है. So you have Mrs. Reema from our reception. So here I walk you through the clinic. So basically I'm walking towards the triage. This is the place where blood collection is done, and small short-term IV treatments or anything is done, taken care here. This is our head nurse, busy as usual.
I have to mention this is one of the most cleanest and the best clinics I've seen in terms of the setup. Watch the setup, it's really huge, really huge.
Thank you so much. So this is the medical director's room, which happens to be my room. So this is followed by the cosmetology procedure room. यहाँ पे हम सारे cosmetic procedures करते हैं जैसे PRP, mesotherapy, chemical peels. Then the next room is the GP consultation room. And then I walk you towards the Ayurveda room. Okay, यहाँ पे आयुर्वेदिक डॉक्टर और होम्योपैथिक डॉक्टर के कंसल्टेशंस होते हैं. Then we have a dental room. So this is the dental room. As you can see, it's completely set. And next is our most favorite department, gynecology department. And walking towards the physiotherapy room. So we have two physiotherapy rooms. Here basically we do the exercises, manual techniques, dry cupping, dry needling, and then here we do the ultrasound electrodes treatment for physiotherapy. This is my most favorite room. This is where we do our hydrofacial. You get 1 hour of hydrofacial, nobody disturbs you, and this is our Ayurveda therapy room. यहाँ पे आयुर्वेदा ट्रीटमेंट जैसे अभ्यंगम, नवरा फेशियल हो सकता है. And not to miss the view. Reema, did you see the view from here?
I love it. Absolutely. It's right opposite the waterfront, which is what I was saying, everybody.
All right.
Lovely. Great.
Yes, Reema.
All right, let's go back. We're going to go back to the reception. If you're watching this live, can I get a big hello? Poonam ji, hi. Hello. How are you all? Kanchi, yes, it is actually a big place. Mukta, hi. Very lovely to see you all. We're going to walk towards the reception and we have a lineup of 6 amazing women we are going to talk to now. All specialist doctors, all amazing in the work that they do. And can I get a big hello if you're watching this live, if I'm audible and visible? Here are our doctors. There you go. Hello, ladies. Girls, they're amazing. Very, very talented, all of them. And they're all going to come live with us. Again, we're going to keep this a very open session. And let me just... Oh, this is not helpful. I just almost fell off. So there you go. Okay, she's going to hold it for me. Thank you. So, hello doctors. Hi Kajal. Hello Neelam ji. This session, just to set up, is about us women. So, you know, if you have a question right from teenage times to, you know, women go to the journey we all go through during pregnancy, after pregnancy, during menopause, anything and everything, the session is very open. So please ask your questions so that one of our specialist doctors can definitely take it up. Hello ladies, I can see. Thank you Reema. Thank you Poonam ji. All right, let's start with our special guest here, Dr. Zooniya. Dr. Zooniya, first of all, congratulations for the amazing setup at this clinic. तो आप मुझे पहले बताओ, how did the journey start? Did you always think about setting up a medical clinic? Is it something your family has been doing, or how did you do it?
Honestly, no.
Okay.
So basically, most of the doctors in the panel would agree that when we start medical, we start with an intention of doing service. This is the best field to giving back to the community, to do humanity services. But unfortunately, when we get into a job, it becomes like a normal job, you know, 9 to 5. वही करना पड़ता है जो बोला जाता है, and service somewhere gets, you know, we can't do the service, we just have to follow the instructions. So when I moved here, I was also looking for a job to practice and unfortunately got tied up in the loop. But when this opportunity came, I felt it's the right platform to do what we want to do to the society, give the best medical services at the affordable prices. At the end of the day, we also have to make our needs, right? So we also have to make money. But yes, doing service is what made me get into the business. My dad is a hardcore businessman.
Okay.
Maybe the genes couldn't be successful for long.
Yes,
so medical and business got together.
Right.
And this is the result of it.
Right. And I've been checking out your Google reviews. You have more than 4.5. So talk to me about that a little bit.
Yes. All those reviews are 100% genuine and with the prices and the services we provide.
Amazing. Let's talk about the prices. You just touched upon them. Tell me, मेरे को ऐसा लगा कि your prices are super reasonable. How is that?
See, basically, जो मैंने जाना यहाँ पे आके, we have come to a foreign country to make our needs. And when it comes to medical, people lose their things and they get frustrated because they can't afford the medical services here. So what they do, non-emergency departments like dental, physio, ayurveda, they keep it for vacation. मैं अब नहीं करूँगी, जब ज़रूरत आएगा तब करूँगी.
Right.
And nobody should compromise on their health. So plan of this that we give the best medical services in the affordable prices. We have come up with prices that nobody can beat. And most importantly, अगर आप वो convert करके Indian currency में देखेंगे, we are still affordable than India.
Oh
so
wow!
Why not get best services in UAE than, you know, taking your health for granted.
Okay, great. Somebody is saying the video is stuck. So can I get a big hello if the video is not stuck? Shalini, can you just tell me if the video is stuck? Can you see us? Or we can do that section again. Very well. Oh, Kajal says very well said, Dr. Zooniya. So congratulations. We also have a question which Shilpa asked. So Shilpa, I'm just going to hold on to that thought and we will come back to your question very soon. So there we go. Okay, the video is working fine. Thank you, Dr. Zooniya. Let us move to our first... Somebody can hold my chair, please. Let us move to Dr. Tehseen Malik. Hello, doctor. For our audience watching us, can you just give us a quick introduction about yourself and your specialty?
Yes, I'm Dr. Tehseen Malik, Ayurveda expert, and I've been practicing in UAE for more than 10 years now. I practice Ayurveda in all niches, but the niche of my interest is women's health, which is the topic for today, fortunately. And I specialize in the conditions for women from menopause, from menarche to menopause.
Menarche, yeah.
Yes, and of course the other related conditions which we cover in Ayurveda.
Okay.
Yes.
Amazing. So, my first question to you is about Ayurveda and the role it plays in women's health. So, tell us a little bit more about it.
See, Ayurveda and women's health Ayurveda talks about women as Shakti, you know,
Okay.
power,
Mm-hmm.
the power of creation, the power of giving birth to the society. And Ayurveda believes that the health of the women is the health of the entire family, entire society, entire nation. So it has a special emphasis on women's health. We have a speciality dedicated to women's health in Ayurveda, a gynecological speciality which is called Stri Rog Vignana. And since I have a special interest in that, so we cover all the diseases related to irregular periods, to teenage menstrual issues, PCOS, endometriosis, infertility problems, to premenopausal, menopausal conditions, and of course in addition to that, conditions related to gut health, because in Ayurveda we believe that your gut is basically imbalance in your gut is a cause of a lot of diseases that happen in your body. If your gut is healthy, your body is healthy. So gut health, skin health, and of course the very much loud speciality of Ayurveda, which is pain management and musculoskeletal issues. So all this we have resources that we treat here in our clinic with very good results.
Amazing. I am just going to do a quick check-in, girls. If you can hear us, if you have ever tried Ayurveda, actually, please give me a yes. Priya ji ka question aaya hai. Priya ji, we will take it up very very soon. Just hold on and listen to our doctors. My next question to you, doctor, is about PCOS and what are the modalities that you take up in Ayurveda while we treat PCOS.
Okay, so PCOS is a spectrum of too many conditions, and people usually come to us when those conditions are out of control. थोड़ा सा period delay हो गया, थोड़ा सा acne आ गया, थोड़ा सा इधर से hair fall हो गया, people are not very much bothered. But when the conditions become extreme, I usually see the girls coming to me. So one request, one advice I would say, the sooner the better.
Okay.
Because हम जितना जल्दी उसको केयर करेंगे, जितना जल्दी उसको ट्रीट कर पाएंगे, उतना जल्दी हम उसको मैनेज कर पाएंगे. So in Ayurveda we take a 3-dimensional approach. Okay? So एक तो analysis पहले होना चाहिए with the Ayurveda perspective, where we analyze each person's constitution, symptoms, उसके दोषास जो होते हैं, वात पित्त कफा, उसकी प्रकृति, और साथ में हम लोग एक इंटीग्रेटेड अप्रोच लेते हैं विद लैब इन्वेस्टिगेशंस, अल्ट्रासाउंड वगैरह. तो उसके साथ एक पूरा कॉम्प्लेक्स एनालिसिस होके एक हमारे पास होता है कि इसका रूट कॉज क्या है. देन द ट्रीटमेंट मोडालिटी स्टार्ट्स विद ट्रीटिंग द रूट कॉज. जैसे मैंने बताया, गट प्लेज एन इम्पॉर्टेंट रोल. तो हम लोग दीपन, पाचन, डिटॉक्स जिसे आजकल हम लोग कहते हैं इन अ वेरी फैंसी लैंग्वेज, तो दीपन पाचन जो आयुर्वेद में किया है वो हम लोग करते हैं. वी यूज आयुर्वेदिक हर्ब्स लाइक शतावरी, अशोका, जो बहुत ही पोटेंट विमेन स्पेसिफिक हर्ब्स हैं, वो यूज करते हैं. ऑयल थेरेपीज हैं जिसे हम कोलॉन थेरेपी कहते हैं, कोलॉन इरिगेशन कहते हैं, वो यूज होता है. ओवुलेशन के लिए हम लोग स्पेशल थेरेपीज यूज करते हैं अगर इनफर्टिलिटी साथ में इन्वॉल्व है. एंड आई ऑल्सो डू हिजामा, कपिंग. Actually, not many people know that cupping also has been a part of Ayurveda. रक्त मोक्षणा जिसे कहते हैं, ब्लड लेटिंग, आपको शायद पता हो, लीच थेरेपी जो इंडिया में यूज होती है. सो वो पूरा हम इंटीग्रेट करके यहाँ पे एक कॉम्प्रिहेंसिव प्लान देते हैं. And the results you must have seen in our reviews that we have very good results with PCOS and PCOS related infertility जो होता है उसमें.
Amazing. I am very happy to say you have a question, doctor, which is very relevant. And Kanchi is asking this question, which says, which is that one Ayurvedic treatment every woman should do repeatedly for overall well-being and good health?
Okay, overall well-being and good health के लिए आयुर्वेदा में जो है 2 पार्ट्स है. एक तो हम लोग कहते हैं कि treat the just keep the root cause away, निदान परिवर्जन, the cause should be stopped. So एक तो है हेल्दी लाइफस्टाइल फॉलो करना, विच इज वेरी इंपॉर्टेंट. एंड द सेकेंड थिंग इज यूज ऑफ वेरी एज स्पेसिफिक हर्ब्स. जैसे शतावरी है तो वो मैं दूंगी फॉर यंग गर्ल्स, ठीक है. लेकिन अगर मेरे पास एक मिडिल एज आए हैं तो यूज ऑफ अशोका. तो कुछ ऐसे एज स्पेसिफिक हर्ब्स हैं जो हमको लेने चाहिए. दूसरा आपको आपकी गट, आपका कॉन्स्टिपेशन, अगर इफ़ यू आर कॉन्स्टिपेटेड, गट हेल्थ पे बहुत ज़्यादा फोकस करना चाहिए. एंड द थर्ड ट्रीटमेंट इज़ द ऑयल थेरेपी, बिकॉज यू नो जो ऑयल होते हैं दे आर डायरेक्ट नरिशिंग टू योर सेल्स. योर सेल इज़ द बिगेस्ट ऑर्गन ऑफ योर बॉडी. उसमें से जो नरिशमेंट होता है. So oil therapies are very much recommended for women, you know, as a preventive to lot of conditions.
Great. I hope that answers your question, Kanchi. Say yes below if it does. I'm going to go back to Dr. Zooniya actually. Dr. Zooniya, when I came in, you mentioned we have a lot of special offers for IWD. Yes. Can we mention that now so that people know about it? Kanchi says, thank you, Reema, for taking up the question. Thank you, doctor, for the answer. So thank you, doctor.
जैसे आपने सुना about Ayurvedic detox. We have a special package exclusive for Indian women Dubai only till the end of this month. It's only at $699. 10 days का detox package है. उसमें 3 abhyangam, which is full body oil massage, 1 consultation and 1 follow-up is included. Okay. और एक है hijama. Hijama generally is priced at $350, but till this month end we are charging only $250 dirhams, irrespective of the cups, with free consultation that is worth $150 dirhams. And also it is not, we will not limit to the number of cups depending on the doctor's view कितने cups किस patient को चाहिए. We are going to be using them all only at 250 dirhams. In addition, we have free dental consultation and free cosmetic consultation till end of this month. और homeopathic में 30% discount for first pediatric consultation.
Oh, amazing. Sounds very good. So, whether you are more a believer of homeopathy or Ayurveda or a general practitioner to whom we are going to go next on to, I think this clinic is a very comprehensive place for all types of treatments. And for me, what is amazing is one, it is an all women run clinic, such an amazing place to be. And for two, like look at the facilities here and the prices. So for the value for money that you get walking in here is amazing. With that, I'm going to move on to my next doctor, Dr. Zainab Khan. She is a GP. So doctor, there you go. Meenu ji, I'm going to take up your question in 5 minutes. Let's just talk to Dr. Zainab. Dr. Zainab, can you just tell me a little bit more about your specialty and yourself?
Hello to everyone. My name is Dr. Zainab Khan and I'm a general practitioner here at Bushra Specialist Medical Centre.
Yeah, great. And my first question is PID, right? So it's something which is very common in women. Can you talk us a little about the signs, the symptoms and the treatments about it? Maybe if you want to hold the phone so that it's closer to you, like here.
Okay,
Maybe, yeah, you can turn it around probably. Let's turn the phone around because then the voice will be more clear. There you go.
Okay, so we must have heard the term PID. PID basically is known as pelvic inflammatory disease. It is actually an infection of the female reproductive parts, wherein we mean the ovaries, the uterus, the tubes, the cervix and the vagina. So what basically happens in PID is inflammation of these structures. What we mean by inflammation is if any offending agent that goes into these parts of the body like bacteria or viruses, then our body naturally reacts to them in the form of pain, swelling or collection of fluid. PID basically is it's a common issue among menstruating women, especially up to the age of 25 to 30. It could affect any age group regardless, but most commonly it is seen in the sexually active age group. It is caused by infected sexual partners, mainly among people who have multiple partners or people who do not take proper barrier methods. They do not use contraception. And also what happens during menstruation is due to the hormonal changes in our cervix, the mucus, the fluid that is produced, the viscosity actually decreases during menstruation. So it makes the breeding ground for the bacteria, which is almost always there around, and it just ascends, it goes up into the uterus and starts creating these infections. So that is what PID is.
Great. Thank you so much. Liji has a question for you. How do we diagnose PID, Dr. Zainab? I think I'll hold it. It's easier probably for you.
As before we go to diagnosis, I'll talk about the sign. How do we know we have PID?
Yeah.
So what happens is I have received patients who are totally asymptomatic. They may not even know that they have PID.
Okay.
The sexual activity and a few questions that we ask as experts will guide us. But the most common signs and symptoms that I have seen a lot of patients come to me with are they'll say, doctor, I have lower abdomen pain, which is, very dull, constantly there. I have burning in urination. I have bleeding between periods. And when I'm having sexual activity, during coitus, there is a lot of pain, and then there is bleeding after the intercourse. They may complain of lower back pain, fatigue, dizziness, vomiting. So the signs and symptoms range from one person to another. And here at Bushra Specialist Medical Centre, we do certain labs, like for example CBC, wherein we look for the infective cells like white blood cells, etc. We do CRP, ESR, ultrasounds are performed, and also we do a thorough physical examination wherein we lead ourselves to the signs and symptoms of PID. So diagnosis is done. Mainly, PID is a historical and clinical diagnosis. That is, history is very important. Now, one of the most important things that I would like to highlight is, I believe that, especially, and I do this with my patients, I'd like to build that rapport wherein I give my patient a comfortable space to be able to speak up about such a personal matter. Because it's a sensitive thing. Not everyone is going to be able to speak to someone or a doctor that they're seeing for the first time. So I personally like to make my patient feel and understand that this is a very confidential information, and this one piece of information where you're sharing about your sexual history, it actually leads us to knowing whether or not it's a PID, because there are many diseases. Like some people might think I just have a UTI because I'm having burning in urine. Some might think, oh, it's just dysmenorrhea, or some might also think it's endometriosis. So there are many other things. So the history is very important to gain in order to direct us to the right diagnosis. So that is why it is always important to be honest with your doctor, share your history with the doctor, and then they'll be able to come to a conclusion.
Okay, great. Anjuji says good explanation, doctor. So thank you so much, doctor. Girls, can you, I know this is something very sensitive and also probably private, but equally important for all of us to know. So my next question to you is, I'll just turn this around, about sexual activity. Do both the partners need to be treated in PID? What precautions need to be taken? When can they resume sexual activity? What is your sort of broad guidance? I know it depends on case by case basis. Yeah. Okay.
When it comes to precautions, it is very important, first of all, during menstruation, to maintain a good hygiene.
Right.
Because let's be honest, sometimes you believe I'm not bleeding much, so I might change after 12.
Change frequently.
So it is always advisable to change within 3 to 4 hours period. So hygiene is very important. Secondly, proper contraception methods should be followed, regardless of the partner.
Right.
So the use of condom, femidoms, etc. is very important. Another thing is about the treatment. Also, it's basically we do swab collections, etc. Then which guides us to which antibiotics need to be given. So usually one dose of injection, like let's say ceftriaxone, intramuscular injection is given, and then doxycycline is given for about 2 weeks. And during that time period, that time frame, it is very important to abstain from sexual activity.
Right.
So once you have completed your antibiotic course, you go back to your doctor for a follow-up and get checked again whether or not the infection has resolved. And definitely the sexual partner needs to be treated as well. And one thing, sometimes you may think like, okay, the last sexual activity that we had was a month ago, so this is totally irrelevant. No. Even if it's been 2 months or 3 months, the infection could still always be there. And it is, another thing I'd like to highlight is, it is very important to treat PID because the complications could be very troublesome. For example, it could even lead to infertility. It could lead to ectopic pregnancies, like abortions. And it could also, you will start living with a chronic pain. Like the pain is there throughout the life, and nobody deserves to live with that pain just because not enough history was taken or you are not honest about your health.
Yes, absolutely. Thank you so much, Doctor. Anu says thank you for a good explanation. I think I just want to re-emphasize that taking care of our health, women's health, is so important. Do not ignore symptoms because you are busy with friends and family and your family life. Notice the symptoms. अगर आपको back pain हो रहा है, abnormal, discharge हो रहा है, you need to come see a doctor. And I can assure you, the confidentiality is maintained for your appointment, so nobody else will know if you are coming. But please take care of your health. We also have another question for you, doctor, from Ligimol. So Ligimol says, any gynecology problem like ectopic can cause PID? Is that related?
PID causes ectopic pregnancy, because what
Okay.
happens in PID is, because you have ignored the pain, you have not been treated, there are going to be adhesions. That is, either the fluid will fill inside the tube or the tubes get blocked. So when you're pregnant, the pregnancy is going to get implanted, is going to take place in the wrong place. Instead of the uterus, it's happening in the tube. So that is where you're going to ectopic pregnancies, which means wrong implantation of the embryo, the fetus.
Lovely. I can see a lot of people joining us. Hi Zankhana. Hello everybody. Thank you Poonamji. Thank you Lata for joining us. Can you say a big hello if you can see this live and we are audible, we are visible. With that, we're going to move on to our next doctor, Dr. Batul. Yeah. Thank you. There you go. Girls, say hello. I want to see everybody. A good morning, right? Hello Anu. Thank you so much. Dr. Batul, can we start a little bit by your introduction? Just tell us a little bit about yourself.
Yeah, so I am a physical therapist.
You'll have to be louder.
I'm a physical therapist and I am specialized in orthopedic and musculoskeletal field. I have 5+ years of experience here and back in our home country. So I am basically practicing myofascial release therapy, like the soft tissue mobilization, manual therapy. I am a certified dry needling therapist and dry cupping therapist. Also, I have certified in like a mino-neurofrequency, which is a Spain-based frequency therapy. It's a very advanced one. So yes, here you go. I'm here for you all today.
Lovely. We are getting a lot of hellos and I love you girls for that. Thank you so much for responding. My question to you, doctor, is around urinary incontinence. Say hello girls, or yes, if you know about this term or one of you has experienced it in your family. Doctor, a lot of us fail urinary incontinence. Can you just explain what the terms mean, and when a patient comes to you, how do you treat that? What does the treatment look like?
Okay, so urinary incontinence is basically that leakage of urine which is not into our control. But what happens is, we are always advised and we are always said by others, that is okay, like, let it be, it will go with time. But no, this urinary incontinence is like something which is, coming from your overactive muscles, or sometimes it can be related to even weak pelvic floor muscles, and sometimes it is opposite. Your pelvic floor muscles are too tight to even hold the urine that much, and there is a leakage. So first of all, it is not to be taken for granted. Secondly, when you come to a physiotherapist, they will do some evaluation, like your history, because mostly post-pregnancy, like post-childbearing age, we do experience that. And as our doctor Zainab mentioned about the PID condition,
Yes.
urinary incontinence can lead to one of that, like, in future, or
Yeah.
something like urinary incontinence leads to prolapse. So a person get into prolapse condition where the organ is coming out, that the starting was a urinary incontinence. So basically, from history, from subjective evaluation, we even check the muscle strength of our pelvic floor muscles. But again, coming back to, it's not just the pelvic floor muscle, because it's also related to our core, which is like the inner abdominal muscles, strength and everything, and overall history. So what we do is, when we identify, okay, there is a leakage frequently, sometimes it is even on exertion, like you are lifting something heavy at the gym and you happen to see that I leak the urine, so that is an exertional or under stress urinary incontinence. So now coming back to what do we do, like how do we treat and like how do we manage it, is first is the education. Like I need to explain my patient that, see, pelvic floor is something like a hammer. So
Yeah.
just imagine the areas around that has soft tissue, ligaments and everything. So sometimes what happens is, lot of people tell us, do Kegels, which is pelvic floor activation exercises.
Yeah.
But dear viewers, don't just take it as an advice, because maybe your pelvic floor is already overactive. You need some relaxations. Like
Right.
You need to release them. So
Yeah.
we do some manual therapy, vaginal massages to release it. Then there is something called dry needling. Dry needling have been used for urinary incontinence, like electric dry needling, which helps to relax that overactive or overstimulated pelvic floor muscle, and they gain their tone back. And most important is, I give my patient exercises in functional activities, not like you have to lay down all the time, but when you're standing, when you're bending, all of that is included, and biofeedback is really important. So we use some pressure biofeedback equipment. So when you are activating that Kegel, and there is something called like you are pulling your pelvic floor up, that is the Kegel, and you are releasing it, that is the reverse Kegel. So patient is seeing that, okay, the pressure is going up, so I'm contracting the muscle, not just like, okay, tighten your pelvic floor. It doesn't help. And as I mentioned, I have to even work on their core and extremity muscles, because at the end our body is as a whole, not just one part. So yeah, this is all what we do for pelvic floor.
Lovely. Great. I can see more people joining us. Hello, Vanita. Priya says great explanation. Thank you. Chandrama ji, hello. Hi, Meenakshi. How are you? Doctor, my next question is around exercise during pregnancy. I think we all want to be fit moms, right? Sabko acha lagta hai. But what is your guidance regarding the do's and the don'ts during pregnancy?
I would come to this point that don't just think when I will get pregnant, because now the celebrities are showing up that yeah, we are pregnant and we are exercising.
I love following Kareena Kapoor's videos and how she gets fit and how Alia Bhatt is already in action.
Yeah, so we need to see that just like before our childbearing age, since then we should start, because that egg, which is one of the byproduct of the pregnancy, is going to be healthy if you keep working out.
Yeah.
Then when it comes to pregnancy, definitely the first advice is you need to know how much was your activity before pregnancy. Because if you were not active at all, you need to start very slow. But if you were an athlete, you were hardworking, with your gynecological, if they agree with you and you are not a high risk patient, you can go on with it under the supervision of a physiotherapist or a fitness trainer. Coming back to this, yes, what can be the exercise plan? So you need to go with some moderate intensity, which I mean by like you 150 minutes per week, like you just divide it 3 to 4 times or maximum 2 to 3 times, like depending on your availability. You should start something like aerobic, which is like large movement exercises, including swimming, the best one, because it offloads your whole spine, because you're already having the baby weight and all. So you can go for brisk walking, swimming, Pilates, yoga, all of these.
Yeah.
Secondly, how much should we strain is the main issue with all of us.
Yeah.
So while you are exercising, you should be able to talk. That is the main sign.
That's a good test. Yeah.
You cannot sing, that is okay, that much intensity is, you should be able to talk very freely. Secondly, mostly what happens is when we are exercising, we forget about the hydration part, but during pregnancy, that is the main thing. Overheating, we should avoid working out in hot weather, like here we stay and we have warm weather outside, so avoid that when you are pregnant. You should be in a cool and warm, cooler place. Thirdly, you need to be very careful when you are exerting any pressure. No exercises for your abdominal areas, no crunches, no sit-ups, no bending over onto your abdomen. All of that needs to be avoided. So here is like all of these you need to follow in order to get a fitter pregnancy.
Great. Lovely. I think a great message for all the pregnant moms out there. If you want, you can reverse this video and go listen to these tips again. But exercise karo, but as much as that you can talk during the exercise. Don't overexert if you've not been exercising before pregnancy. So, suddenly don't start and give jerks to your body. My next question is, if you are 40 plus, 45 plus and you're watching this, can you say a big yes? Because I want to know how many people are watching this. I want to talk about post-menopausal osteoporosis, doctor. What exactly is post-menopausal osteoporosis and how do we treat that? What we should keep in mind?
So yes, as the name suggests, it's after the menopause or at the beginning of menopause. What happens is our bone, like osteo is the bone and the porous is, it becomes porous, like less of the mass in the bone, like bone mass reduces. Now why does it happen? We have a very good friend, estrogen hormone, which is, bone forming. But as we are entering our menopausal age, this estrogen starts to decline. So just imagine, once that hormone is no more activating our bone, calcium from the bone is taken up. So what remains is that porous bone. Now this porous bone leads to a number of things like fractures, pain, bone pain, and etc. So we need it is like really important to make females aware, not when they have already entered that menopause, but prior to, even since the beginning of their menarche, that this is how there will be, you know, hormonal shift at the end of your menarche. So you need to be aware, you need to get your supplements on time. Calcium D3, here we all are lacking in D3, no doubt. So sun exposure. And now I'm coming to the point where how will you manage this?
Yeah.
Okay?
Yeah.
So post menopausal osteoporosis, you need to start exercising.
Right.
Now, what kind of exercise is something we have to talk about is progressive resistance. Like you need to increase your resistance. There has to be not just, okay, I lifted the dumbbell, 2 kg dumbbell for one whole week. No, you need to increase it like in a proper loaded form.
Yeah.
Secondly, the very important and like evidence-based exercise is your weight bearing, like jumping, multimodal, like you jump, cross jumping, bench, step up, step down. Because when we are bearing weight, our bone is, I forgot to tell you, like bone is a living tissue. So when we are putting stress on it, it like kinds of, you know, activates mechanical loading we call, and that help to, you know, more calcium deposit and making bone more stronger strength wise. So weight bearing exercises, resistance training, group exercises, this all needs to be implemented in your routine.
Yes.
In order to, you know, get
Lovely. I have to say, doctor, this is one of the most popular questions because when I yes bolne ko bola, so we have so many yeses. So let me see. Priya, Meenu, Divya, Poonam, Mukta, Geeta, Alia, all of these ladies are 40, 45 plus, and I think a question very relevant to them. I'm going to move on to my next doctor. Thank you so much. Dr. Nikita. Dr. Nikita is going to talk about a question about a topic which I'm very scared of. I'm scared of dentists, and I think a lot of us are. So we're going to talk about more about cavities and dentals, but let's do a little bit of introduction with Dr. Nikita. So Dr. Nikita, can you just tell us a little bit about yourself?
Hi, my name is Dr. Nikita and I'm a general dentist at Bushra Specialist Medical Centre. I have a total experience of 4 years in my home country in UAE as well.
Amazing. Dr. Nikita, let's talk about cavities during pregnancy, and can you just tell us a little bit more about the topic?
Okay, cavities during
Pregnancy?
pregnancy.
Yeah, oral cavities during pregnancy?
So, oral healthcare hygiene is most often avoided unless taken care of by most pregnant women. Now, being pregnant increases your risk of oral health problems due to hormonal changes happening, and this in turn can affect your pregnancy as well. So, one of the most common signs which you would see in the mouth is red, swollen, bleeding. Now, this also you would see increase in the number of cavities in your mouth. Now, this happens, as I said before, due to hormonal changes. There is increased plaque accumulation on your teeth, which is the most common cause of gingivitis and cavities. Also, we know pregnant women have frequent snacking, sugar, cravings.
We just go on that route of eating.
Constant munching and all.
Yeah.
So this also leads to increased cavities in your mouth. So what you have to do is, you have to brush twice daily with a fluoridated toothpaste, clean your tongue and floss at least once daily. And as Dr. Batul just mentioned, you need to be very well hydrated during your pregnancy. Drink plenty of water between meals and eat plenty of fresh fruits and veggies. Then another condition which you will be seeing is tooth erosion. That means wearing away of teeth.
Right.
So with pregnant women, we know that there might be morning sickness, vomiting, nausea, acid reflux and all. So the acid that is produced in the mouth when it comes in contact with our teeth, that harms our enamel. That causes loss of enamel. So then when we brush our teeth, we are harming our enamel and the enamel is lost, which leads to sensitivity. So what we have to do is, instead of immediately brushing your teeth, you need to rinse your mouth with water.
Okay.
Then wait for at least 30 minutes before brushing your teeth. So in this way, we can protect our enamel and then prevent future sensitivity as well.
Amazing. That's a great tip for us. I didn't know that we have to wait for 30 minutes. But there you go. Okay, Chandrama, you want to ask a question regarding arm lifting. So we'll come back to you, Dr. Chandrama. Please type your question in the comments below and we will take up with the doctor now. After this, once I see your question. So in the meantime, Dr. Nikita, which is that one drug which is safe for women during pregnancy and they can consume?
Okay, so one of the safest drugs we say is paracetamol.
Yeah.
Unless we are allergic to it.
Okay.
But what we advise is we should not simply blindly just go, if you have pain, just go on paracetamol.
Yeah.
If only you are at a stage where you cannot meet with your healthcare provider or gynae, at most you need that, only then go for that. Otherwise, it is always advised you consult with your healthcare provider before taking any medications. Do not go for any home remedies which you may come across Google, YouTube and all. Because I've seen people who go for home remedies like that. So you actually do more harm than good.
Yeah.
So one of the safest drugs is paracetamol, which I would say.
All right. So if you're pregnant, please do not take any medicines without doctor's approval. And if you need to take, I think paracetamol is okay to take. It's the safest for you. I can see Dia, I can see Kajal joining us. Thank you, Alia, for that beautiful comment. Really, really thank you. Doctor, one more question. Dental treatment in women during OCP. Can you just explain us what that means? And
Oral contraceptive pills.
Yeah.
Women taking oral contraceptive
Yeah.
pills, even that causes hormonal changes as well. So, suppose you have a toothache and you need to be prescribed antibiotics. You need to inform your dentist that you are on OCP. Why? Because antibiotics reduce the effectiveness of oral contraceptive pills.
right.
So you have to inform beforehand that if you are planning or you are taking oral contraceptive pills, it is a must that you need to inform your healthcare provider about it.
Right.
Also, like suppose you have a wisdom tooth impaction and you need to get it removed.
Yes.
In women taking oral contraceptive pills, there is a complication which may arise, which is called as dry socket.
Right.
That means usually there has to be a clot to be formed after extraction so that bleeding will stop. In people taking oral contraceptive pills, there are high chances the clot will be dislodged and dry socket will form, which is an excessive painful condition that can develop. So my advice is please inform your healthcare provider that you are on OCP.
Okay, great. We have, girls, if you're watching this, we are also giving one free teeth whitening treatment with Dr. Nikita. So you can come and see us. For that, the team is going to share a form. Please fill in your details in the form and one lucky winner gets to come to the clinic. We have 2 more questions for you, doctor, from the audience. How often should we get teeth whitening done? That's the first one. And the second question is from Divya, who's asking, is it good to use an electric toothbrush?
Okay. First question, how often should you get teeth whitening done? Teeth whitening is actually a simple and invasive procedure. Only it's a cosmetic procedure to get your teeth whitened. Don't go for it at least once a year.
Once a
Don't do
year.
it frequently. No, we don't advise doing it very frequently. Once a year.
Once a year is
Yes.
good. Okay, there.
Second,
Yes.
always an electric toothbrush is better than the manual toothbrushes. Why? Because you have controlled forces. With manual toothbrush, you have a misconception that the harder you brush, the more cleaner your teeth get.
Yeah.
Which is exactly the opposite. The harder you brush, you harm your teeth and your gums as well. So with electric toothbrushes, we have a controlled force and the movement so that we can actually control our movement and protect our teeth.
And protect that teeth. Makes sense. Is it advisable to use baking soda?
No, please don't use baking soda.
घर के इलाज मत कीजिए, please.
Baking soda, it's an abrasive, so it
Yeah.
will only harm your tooth. Like just before I said, it will only wear off your enamel and cause
Yes.
tooth sensitivity. Never ever follow Google or YouTube and
Yes.
use baking soda for teeth whitening. I know you all will see, but please never go for it.
Yes. I think the only thing I can say is, guys, Google and ChatGPTs are not your doctors. Please come to a specialist doctor for treatments. And so there we go. We're going to go back to Dr. Zooniya. We started our live with her, for those who've been watching us. And surprise, she's a doctor herself. So we're going to, देखो हमने pregnancy की बात की, हमने 45 plus की बात की. Our next question is around teenage. And I think in teenagers, as you know, girls get to that teenage age, acne is one of the most common problems. So Dr. Zooniya here specializes in that. So my first question to you, Dr. Zooniya, is around teenage acne, how we can treat it, what we should keep in mind.
I believe most of us here
Yeah.
have undergone that.
Yes,
right?
completely.
Teenage acne is very common, and
Yes.
to be honest, it should be stopped treated as a taboo.
Yes.
It's more of a physiological process because of the hormonal changes that occurs in our body. So people start to pick their acne, start complaining, applying toothpaste, whatever. Right?
Yeah.
So firstly, what I suggest is don't go for any cosmetic treatment under the age of 18 because
Okay.
our skin has a natural skin cell cycle. Every 4 weeks, our skin cells degenerates. Okay?
Yes.
So when you go for a cosmetic treatment, you're basically harming your skin. Instead, I'd advise you to go for derm or a esthetician consultation and get a proper skincare routine.
Right.
If you manage your acne properly, it will go without leaving a scar. And later on, you may just have few spots. It's very easy to correct.
Yeah.
And if some kids, if you see the teenagers, they get into depression because of their acne or something. Only in that cases, see a treatment and see a specialist and get a treatment done. If not, a proper skincare routine is more than enough to
Yeah.
maintain your teenage acne.
Lovely. We girls, so there we go. Please do not go for cosmetic treatments if your girls are young. I think they're just too young and they need to settle down to 18 plus. Next question for you, doctor, is around pregnancy. There are a lot of skin changes, hormonal changes during pregnancy. How do we deal the skin side of things for them?
One of the most common issue which I see in a pregnant woman is a condition called melasma.
Yep.
It is also called as mask of pregnancy. Okay, so it's very common in Asian women, and if you have a familial history, so be more than welcome to expect it. So basically, what you see in this condition is a pigmentation over your cheeks, foreheads, nose, and sometimes around the eyebrows. And please be aware, it is asymptomatic, which means there's no itch, there's no pain,
Yeah.
there is no discomfort as such except the pigmentation. If
Right.
you have any of the symptoms, it may not be melasma.
Yeah.
And 90% of the cases, postpartum, the melasma just becomes okay, the pigmentation is back to normal. If not, you can use something called azelaic acid during your pregnancy. And there are lots of over-the-counter serums which has to be avoided during pregnancy and lactation. So now you see there are so many influencers, TikTokers, they come and they tell you to use anything and everything.
Yeah.
But please be
Don't,
aware, do
don't,
your research,
yeah.
seek a medical help, because certain things like retinol serum, which is very common, has to be avoided during pregnancy. It's a big
Right. And can we use hyaluronic
Hyaluronic
acid?
acid, yes.
Yes.
It's very safe. It's a very good hydration. You can use hyaluronic acid. And if it's more on oily side, you can use something very mild like glycolic acid or malic acid. But again, there is something called salicylic acid. So please stay away from this
Right.
during your pregnancy. So it's very important you just get a consultation done and know what is right for your skin.
Right.
To maintain the natural pregnancy glow you've got during your pregnancy.
Yeah, I mean enjoy the glow, right? My next question is around जब दुबई आते हैं ना तो बहुत hair fall होता है, dandruff भी होता है. What can we do around the Dubai problem of having a lot of hair fall?
Okay. So पहले मैं एक misconception हटा देती हूँ कि दुबई के पानी से hair fall
That
होता
is
है,
that
right?
is the water to blame, no?
Exactly, but actually UAE government has said the municipality water is very safe, it doesn't cause hair fall. So what else could activate the hair fall in UAE is deficiency of vitamin D.
Right.
Most of my clients who come with hair fall, I don't jump into the treatment because the common problem is deficiency of vitamin D. Okay, so basically it's very important to get your vitamin D tested and start taking your supplements. In addition, what we do is a treatment called PRP. So we basically take your own blood, plasma
Yeah.
nikal ke, we just inject in your scalp. It's a very safe and effective treatment, and it's also called as vampire facial, Kim Kardashian. So it's just the same treatment.
Yeah, yeah.
And dandruff, again, the reason is the hot water we use for shower.
Yes.
Right?
Yes.
And I guess it's something you can't avoid in UAE's heat.
Yes.
So we have to go back to our old technique of having a bucket.
Ah.
So you don't have the very hot water to dry out your scalp. Other than that, you can look out for salicylic acid, ketoconazole, coal tar. This composition should be there in dandruff shampoos.
Right.
Okay? And one more thing is dandruff ziddi hota hai. After 3 months, the same shampoo will not give you the result what was giving. So you have to switch your anti-dandruff shampoos.
Right.
Okay?
Great. You've got a fan out there who's saying Dr. Zooniya is the best. Really, it's my experience. Thank you so much, Amal. There we go, girls. So, if you're watching this and you're finding this informative, we've got all the specialists here lined up for you. I want you to say a big hello. Leave us a heart. Leave us a like. हमको भी अच्छा लगता है, please. With that, we're going to move on to our last doctor for this live. And हमने homeopathic, हमने Ayurveda का बात किया, हमने GP से बात किया, हमने dentist से बात किया. I think the next one, which is on our list and something which is हमें लगता है कि India से है, we'll clear that misconception soon, but is homeopathic. So, doctor, let me just show you the doctor first. Hello, doctor. Dr. Sakina. Dr. Sakina, can you do a quick introduction about yourself first?
Myself, Dr. Sakina.
You have to be louder.
I'm Dr. Sakina, practicing here in Bushra Specialist Medical Centre. I have an experience of 12 years. I'm
Wow.
practicing homeopathy from last 12 years.
So, doctor, homeopathy is one of the things which we say. Hello, hi, Ritu. Ritu just joined us. There you go. Ritu, we say that it should be used in kids, in children. So, at what age can we start homeopathy for the
We can
kids?
start homeopathy in kids right from the child is born. From the newborn kids.
Okay.
From the first day the child colic, we can start homeopathy, and it can be taken till death.
Oh wow. Okay. अगर child को colic हो रहा है, तो what do you recommend in homeopathy? Because you know, what
See, we have a different feel when this is the most commonest called when the child is born.
Yeah.
And because of the diarrhea, the blackish
Yes.
discharge from the mother,
Yes.
it is coming out. The colic starts.
Yes.
And
Yes.
there are various. See, in homeopathy, it's not about colic.
Yes.
There are various different beautiful medicines from colic
Yes.
to dentition, where there are dental troubles in
Yes.
child during the teeth are coming.
Yes.
Then in children, various bedwetting issues, stamp weight, delayed milestones. Wonderful.
Yes.
Homeopathy is a like child. And see, homeopathy is a mild and very gentle medicine.
Right.
Prepared from a natural substance. So a mother can give homeopathy medicines right from the birth because it will not cause any kind of side effects to the children.
Right.
And you know, being some, I'll go to like, it is sweet.
Yes, it is sweet. Yeah, I
Being a
remember.
sweet one, the mother, the hustle what she goes, the efforts what she puts to give the child the medicine.
Yeah.
Child copied so beautifully.
Yes.
While taking the homeopathy.
You
You,
know-
don't have to run. Children will ask for the medicine.
Yeah.
Mama, I want my medicine.
Yes, and I think one of the medicines which I use because my kids are like growing age, they're 4 and 7. I use Calcaria phosphorica.
Yeah.
Is it recommended or is it not recommended? I would love to clarify that.
Calcaria for 6x is where
Yeah.
recommended right from the dentitional period.
Okay.
Because when the dental trouble, where the child is having the issues, and that from that we recommend Calcaria for, and it is given for the growth of the bones also.
Yes.
Teeth, bone, wherever
Yes.
the calcium is required, it is
That's
given.
that's where you.
And we are telling now, see, the child development.
Hmm.
Homeopathy is recommended to the children because of the in the development, your immunity is building up.
Right.
And homeopathy is one of the natural system where the immunity is, the child immunity is building up properly with a natural medicine.
Amazing. There we go. So in addition to calcium, doctor, which are the other common illnesses that we should be, for which homeopathy is recommended in kids? The most common ones with which people come to you.
See, the most commonest one is the respiratory issue. The
Okay.
cough, cold,
Yeah.
adenoids.
Yes.
See, nowadays adenoids are the most commonest where the tonsillitis,
Mm.
the enlarged tonsils.
Right.
In many of the cases, surgery has been advised for the enlarged tonsils, but homeopathy handles it in a very well way.
Mm.
The surgery can be avoided, and with the proper treatment of homeopathy within a duration of time, tonsillitis can be completely curable with homeopathy. Asthma, one of the cause where the mother is in the hustle of giving the pump and everything.
Hmm.
With the proper homeo, with the dilutions and everything, when you give it to the children, the asthma is very well manageable with homeopathy.
Great. I think that's great information. I think we, especially in Dubai, हम AC को बहुत blame करते हैं, and we say children को allergy हो गया है, AC में problem हो गया है. Maybe if you're giving any hard medicines to your kids for all of these treatments, try homeopathic once. Maybe come see doctor for a consultation, and then you'll get. Thank you so much, doctor. I'm gonna go back to my favorite Dr. Zooniya. We are back with you. Thank you so much for this lovely live session. Can we just do a reminder of all the special offers that IWD has when they come here?
Okay, so IWD 10 is the code you have to use. It's going to be valid throughout the year. Any services you take, you get 10% discount. And I would like to highlight our GP consultation is only 29 dirhams.
Oh wow! Oh my God!
And you get 10% discount.
And you get 10% discount, yeah. I mean, yeah, that is an amazing
And
price.
also we have various blood packages as well for blood tests. Now,
Okay.
For example, I'm holding something.
Yes,
You can see it's
let's
just
see. Let me just
72
show you.
parameters for
Okay.
150 dirhams, which
Which-
also includes vitamin D.
Yes, typically vitamin D is not included in all of these.
True.
Yeah.
So you have packages like this. In addition, we have Ayurveda Detox, which I told you earlier about. It's
Yes.
a 10-day session, which includes 3 Abhyanga,
Yes.
1 consultation and 1 follow-up for only 699. Then we have Hijama offer, which is 250 dirhams. Normally it's charged at 350. And even consultation is free, which is 150 dirhams. And you have 10% discount on that.
Mm-hmm.
And free cosmetic consultation and dental consultation till end of this month. And as you heard our Dr. Sakina Homeopathic speak about pediatrics,
Yes.
she is giving 30% discount to the first pediatric consultation.
Oh, amazing. That is a great offer. Thank you so much, Dr. Zooniya. Do we have any closing remarks from the doctor? Anybody wants to say anything?
Before that,
just like to highlight about
Yes.
Physio offers as well.
Please do,
If you
please
take
do.
5 sessions, you have 1 session free.
Oh wow.
And Reema, just a little time to introduce my backstory.
Absolutely.
The backbone of the clinic.
They are the strongest ladies out there who actually run the clinic. Say hello. Let's just get to hear a little bit about your name and how long you've been around and what you help the more in the clinic around.
Hi, my name is Abhini. So I'm here almost 1 year,
Uh-huh.
and I'm working from the nursing side and from the administration side.
Yeah, and Abni is the one who's sending the message. So you make sure everybody comments on her. Hello.
Hello, my name is Anju. I'm here in 3 months. I'm
Yeah.
a nursing side.
Amazing, Anju. Thank you. Hi.
Hi, I'm Miss Lichi. I'm head nurse of Bushra Medical Centre. Last 3 years I am working here as
Yeah.
a head nurse.
Amazing. So there you go. Hi.
Hi, good morning. This is Helen,
Yeah.
medical receptionist from
Yes.
Bushra Specialist Medical Centre.
Oh, you're gorgeous. There you go. Hello. Okay, great. Lovely to meet. You have a fabulous team. I'm going to show all the team here. एक बार मैं सबको दिखा रही हूँ. Just so you, there you go. There you go. That's our doctors. I think we've seen all of them on the live already. Yes. Hi. Say hello.
Good morning to all.
Yes. Say, tell us your name and how long you've been around and what you specialize in.
For 3 years, I'm doing facial.
Ah, so you are the one who will do the hydrofacial when
Yes,
people
I
walk in.
am.
Okay, there you go. Lovely. So there we go. We go back to Dr. Zooniya. Thank you so much. Any closing remarks for IWD who's watching us?
Please remember our health. As women, we are the source for the family. Please don't
Yes.
take your health for granted. This show is exclusive for all women,
Hmm.
and we have given various offers. So please don't wait till any emergency happens.
Yeah.
Don't keep delaying, because a small cavity, when it ends up in root canal, you will never know. You can just do a filling. So always just go to the medical experts, and we are giving free consultations till end of this month. So make use of it. Why not? Right?
Lovely. We are getting questions on the live, so I will actually ask the team to reply to you on the lives also. So Chandrama ji, I think आपका question रह गया है. Priya, your question, and Meenu. But I have to close this live now, just in the interest of time. A big thank you to the team of Bushra Specialist Medical Centre. We have amazing offers, girl, and the location is perfect. It's right opposite the waterfront in Sharjah, so you all can turn up here. We are giving one free teeth whitening treatment to everybody who fills the form. The form link is above. Plus their exclusive special offers, and I'm going to mention those special offers on the top of the live also once I get home from here. So make use of this brilliant opportunity. Come to this beautiful place being run by an all-women team, which I'm so proud of. And thank you IWD for being fantastic always.